Hi, my dear students. Have a nice day for you. Today, we are going to learn a topic that is rectus sheath. What is rectus sheath? It is an aponeurotic sheath which encloses the rectus abdominis muscle and pyramidalis muscle if it is present. It is seen on either side of the linea alba, and it is derived from the aponeurosis of three flat muscles that is seen on the anterior abdominal wall. Then the three muscles, the flat muscles that is seen in the anterior abdominal wall are external oblique, internal oblique and transversus abdominis. Some of the important features of rectus sheath. The rectus sheath presents two walls, anterior wall and posterior wall. Then take the anterior wall. The anterior wall is complete. It covers the entire extent of the muscle longitudinally from the upper to the lower end. And its composition is variable, and this anterior wall is firmly adherent to the tendinous intersections of the rectus abdominis muscle. Then next, the posterior wall. It is deficient above and below, and hence it does not cover the entire extent of the muscle longitudinally. Above the posterior wall is attached to the costal margin, that is 7, 8, 9 costal cartilages, and thus the muscle that is above lies directly on 5, 6, 7 costal cartilages. Below the posterior wall, it presents a free curved margin with concavity facing inferiorly called arcuate line or the line of Douglas. It is seen between the umbilicus and the pubic symphysis. Below this level, the muscle lies directly on the fascia transversalis. The formation of rectus sheath differs from above downward as follows. Above the level of costal margin, the anterior wall is formed by the aponeurosis of external oblique only. The posterior wall is deficient and the muscle lies directly on 5, 6 and 7th costal cartilages. Between the costal margin and the arcuate line, the formation of the walls. The anterior wall is formed by external oblique aponeurosis and anterior lamina of the internal oblique aponeurosis. Posterior wall, it is formed by posterior lamina of the internal oblique aponeurosis and aponeurosis of transversus abdominis muscle. Below the arcuate line, the formation of the rectus sheath is as follows. The anterior wall is formed by the aponeurosis of all the three flat muscles. The aponeurosis of the transversus abdominis and internal oblique are fused, but the aponeurosis of the external oblique remains separate. The posterior wall below the arcuate line is deficient. The muscle directly rests on fascia transversalis. We can summarize the formation of rectus sheath. Above the level of costal margin, anterior wall is formed by the aponeurosis of external oblique only, and the posterior wall is deficient, and the muscle lies directly on 5, 6, 7 costal cartilages. Then between the costal margin and the arcuate line, the anterior wall is formed by the fusion of aponeurosis of external oblique with the anterior lamina of aponeurosis of internal oblique. Posterior wall is formed by the fusion of the posterior lamina of the internal oblique and the aponeurosis of the transversus abdominis muscle. Below the level of arcuate line, anterior wall is formed by the aponeurosis of all the three flat muscles. Among this, the aponeurosis of the transversus abdominis and internal oblique are fused, but the aponeurosis of external oblique lies separate. Posterior wall is deficient. Here the muscle directly rests on fascia transversalis. This is the formation of rectus sheath. In this picture also you can see the formation of the rectus sheath, but according to the recent view regarding the rectus sheath formation, recently it is found out that the aponeurosis of all the three flat muscles, that is the external, internal and the transversus abdominal muscle, they are bilamina, thus giving 6 lamina in all, and the anterior lamina is formed by the 3 layers and the posterior lamina is formed by the other 3 layers. The lamina, they do not terminate in the linea alba, but they accusate with the other lamina across the midline, that is in the region of linea alba, and it continue as the lamina of the contralateral muscle. Coming to the contents of the rectus sheath, there are 2 muscles, 2 arteries, 2 veins, 6 nerves. 2 muscles are rectus abdominis muscle, that is the largest content, and pyramidalis muscle. Then 2 arteries, that is the superior epigastric artery and inferior epigastric artery. 2 veins, that is superior epigastric vein and inferior epigastric vein. Nerves include, there are 6 in number. They are the lower 6 thoracic nerves. That means there are lower 5 intercostal nerves and the lower 6th intercostal nerve, that is the 12th intercostal nerve, that is the subcostal nerve. And all these nerves are accompanied by the terminal parts of the posterior intercostal vessels. The superior epigastric artery enters the rectus sheath by passing between the costal and the xiphoid origin of the diaphragm. The superior epigastric artery is a branch of internal thoracic artery. It supplies the rectus abdominis muscle and anastomose with the inferior epigastric artery. The inferior epigastric artery is a branch of external iliac artery. It enters the rectus sheath by passing in front of the arcuate line. The veins are the superior epigastric vein, which accompanies the artery and it joins into the internal thoracic vein. The inferior epigastric vein, which also accompanies the artery, it drains into the external iliac vein. The next content of the rectus sheath, they are the intercostal nerves, that is T7 to T11. They pass from the intercostal spaces into the abdominal wall between the internal oblique and transversus abdominis muscle and run in this neurovascular plane. It enters the rectus sheath by piercing the posterior lamina of the internal oblique, aponeurosis. Within the sheath, they proceed forward deep to the rectus muscle to about its midline and then enter the muscle, supply it and emerge through the anterior wall of the sheath as the anterior cutaneous nerve. Functions of rectus sheath include checking the bowing of the rectus abdominis muscle during its contraction, and hence increasing its efficiency. Maintains the strength of the anterior abdominal wall. Divarication of the recti, that is the separation of the recti abdominis muscle. The separation of the two recti muscles usually occur in elderly multiparous women with weak abdominal wall muscles. In this condition, the aponeurosis forming the rectus sheath become extensively stretched. Consequently, when the patient coughs or strains, the recti separate widely and hernial sac containing loops of intestine protrudes forward between the medial margins of the recti. The next is epigastric hernia. The linea alba, a midline fibrous raphe, which is formed by the interlacing of the aponeurotic fibers of the three paired flat muscles of the anterior abdominal wall. It extends from the xiphoid process to the pubic symphysis. Above the umbilicus, it is about 1 centimeter wide, and below the umbilicus, it is very narrow. It becomes weak in elderly multiparous women and chronically ill children. When the intra-abdominal pressure extensively rise or excessively raised, a small amount of extraperitoneal fat may protrude through the upper part of the linea alba and eventually may drag behind it a small peritoneal sac which contain a portion of the greater omentum, and this is the epigastric hernia. And the other one is hematoma of rectus sheath. Sometimes the superior and the inferior epigastric artery are unduly stretched during a severe bout of coughing or in the later months of pregnancy and ruptures. So, it leads to the formation of hematoma within the rectus sheath. So, clinically it presents midline abdominal pain and tender mass confined to the rectus sheath. The next one is regarding the incision. There is supraumbilical median incision through the linea alba, which has several advantages because it is bloodless, safety to muscles and nerves, but tend to leave a post-operative weakness through which a ventral hernia may develop. Infraumbilical median incisions are safer because the close approximation of the recti prevent formation of any ventral hernia. Paramedian incisions through the rectus sheath are more sound than the median incisions. The rectus muscle is retracted laterally to protect the nerve supplying it from any injury. In these cases, the subsequent risk of weakness and of incisional or ventral hernia are minimal. The next regarding the reconstructive surgery of the breast. The pedicle flap of the upper part of the rectus abdominis muscle based on the superior epigastric artery is commonly used in the reconstructive surgery of the breast. Thank you. Have a nice day.